in the journal, the physiotherapy, the CSP's journal, I saw some lot of articles. So that inspired me that I should submit this paper to the CSP Congress. Okay, and I'm here standing in front of you. And the interesting things in the professionalism, the definition is the competence, the skills, and the code of behavior. It's a combination to ensure that ethics and dignity of the profession are maintained. Okay. In physical therapy, there are three dimensions. One is for the patients and the clients. The other one is the advice giving and the lobbying. And the third one is to coordinate with the legislative and the administrative bodies. Okay. It includes everything, includes professionalism. In the history of professionalism in medicine, Hippocrates' Oath and the American Medical Association Code of Ethics emphasizes this. Recently, the Physician's Charter also emphasizes this. In physiotherapy, we have increased professional autonomy and we have increased accountability together with this. In 2003, the American Physical Therapy Association developed the core values definition, and they try to include this as part of the curriculum in the entry-level physical therapy programs. And they also published the guide for professional conduct. We aim to understand the current levels of professionalism among the physical therapists in order to get an implication for education and curricular modifications. So the objective of the present study was to assess the levels of professionalism. The study was approved by the organizing committee of a conference. Okay, it's a national conference conducted annually in a professional association, and participant anonymity was maintained by coding, and it was wholly voluntary from all the physical therapists who attended the conference. Study design was a cross-sectional study, and it was in the conference. Okay, it was in my place, Mangalore, India. The survey instrument was defined as the professionalism in physical therapy core values instrument, and it had 7 core values: accountability, altruism, compassion, excellence, integrity, professional duty, and social responsibility, which was rather surprising. You know, I didn't know all these 7 values existed. And each of these had some indicators like statements, and which have to be rated on a 5-point scale, like how often or never. We considered 7 professional categories, including the students and practitioners, the teachers, and the age and gender as the individual variables. We used one-way analysis of variance to score, and the post-hoc testing using the SPSS. We got a better response rate. It was surprising because the organizers distributed the questionnaires and they collected for me, and then we analyzed it. We found the physical therapist, the female physical therapist, had a higher overall score, the higher levels of professionalism compared to the male counterparts. However, statistical significance did not show that. Age was also higher. Age was associated with higher levels of professionalism. Okay, the older the person, the higher the levels of professionalism was. Individually, the core values, there are some things. Out of the score of 240, overall scores were lesser. And you see that there's a mixed trend in the values, and over the years of students from second year, third year, and fourth year physiotherapy students to interns, there's an increase in the trend of levels of professionalism. And you can see accountability was greatest among the teaching faculty. Altruism, the selfless behavior, okay, is among the clinicians and therapists. Compassion was among, again, the clinicians, and excellence was reported by researchers, integrity also by the researchers, professional duty again by the researchers, and social responsibility was more among the clinician therapists. As we saw among the professional categories, teachers had a high scores of accountability and excellence, but low scores on altruism and professional duty, surprisingly. And researchers had higher scores of integrity and excellence. Again, they had low scores on altruism and professional duty. Clinician therapists had higher scores of compassion and social responsibility, and low scores on integrity and professional duty. Administrators, those who have the institution heads and the responsible people, they had higher scores of accountability and social responsibility and lower scores of altruism and professional duty. What we actually suggest for future studies, because we had a mixed finding and it's very interesting to do this survey, was something to compare between the countries geographically and try to see whether there is any difference based on the population characteristics. And what we measured was the self-reported and levels of professionalism. So the actual behavioral assessment of what actually happened in reality. We could do a behavioral assessment, and maybe the assessment could be rated more from the clients. Maybe teaching faculty could be evaluated from students' evaluations, and clinicians could be evaluated from the patients, and the researchers could be from their subjects. Okay, something like. And we need to also work on the relationship of the levels of professionalism with the work-related efficacy and work satisfaction, because those who may be not satisfied with being in the profession may report lower levels of professionalism. Okay. And two other interesting terms, the professional socialization and professionalization should also be studied in relationship with the levels of professionals. Our study limitations were the study sample included the participants of a conference, okay, so and it was in the one country, single nationalities, and it's self-reported, and the efficacy with related to work is unknown. To conclude, we had lower levels of professionalism overall, which attributed to the mixed findings, and there was a positive effect of the students on the curriculum. Okay, as the years of study increased, those students had higher levels of self-reported professionalism. Okay. And to share a few pictures, in WCPT I met the team of CSP, okay, at Amsterdam, and I had an excellent reception yesterday, okay, organized. And that was today, phenomenal gathering, and I'm very proud to wear this, okay, the flag of the UK and with the physiotherapy works, okay. It makes me feel professional, okay, professionalism. And it's a great experience to be here in CSP. Everyone kept asking me, you came for this conference specifically from India all the way, okay. But I wanted to meet the people, okay, who have been publishing good research on professionalism in the physiotherapy, the journal, okay. And I wanted to come to this place to see. And you all are please welcome to India, okay. And India is a beautiful place with beautiful people, okay. Keep connected with them and keep in touch with me and see how well we can take things together. That's the picture of my wife and my boy, okay, who was born this January in our Indian costumes, okay, for all of you. And thank you so much, and thanks for your patient hearing, and thanks for waiting, and among the few who are sitting here in the hall, okay. I'm really happy to see all of you here, okay. Thank you. Last slide is a little bit message which I found really funny on Facebook, okay. Thank you so much.
Thank you. It's time for a quick question if anybody would like one. Oh, yes, one at the back there.
Hello, Anna Jones, Northumbria University. Could I just go back? You listed the values and the attributes, and then what were the people scoring? They were scoring agreement or?
They scored on the frequency of how often they perform such an act in reality, like rarely, often, occasionally, never, frequently, like.
Thank you very much.
It's always good to get a question.
Okay, thank you very much. Thank you.
Thank you.
Right. Our final speaker today